Welcome to Plus Talk on Plus Life, where we are all about turning positive into a plus. Dental health. It's something that none of us really like to think about much unless you're slightly crazy and enjoy going to the dentist. Some people do. I don't. Although, if my dentist was Peter Bonifato, I might change my mind. Hey, Dentist Pete, thanks for being here and chatting with us today. Nice to see you.
Nice to see you too, Carl.
Peter, we want to get to a lot of things in a really short amount of time. I want to talk about COVID. I also want to talk about HIV, but I also want to talk about just generally the importance of going to the dentist, because I think when we think about HIV or general sort of health, we don't think about the role our mouths play and indeed good oral health. So just how important to a healthy immune system are healthy teeth and gums?
Well, people like to think that the mouth and the body are two different things, but the blood that's circulating in your mouth is the same blood that's circulating throughout your whole body. And with your heart pumping 60 beats per minute, a piece of bacteria in your mouth can reach your toe in 1 minute. So overall, the same pathogens in your mouth are throughout your body. So a good, healthy mouth equals a good, healthy body.
So just how important, though, is it for people living with HIV to consider going to the dentist on a regular basis? Because, we get our blood work done 2 or 3 times a year. How often should we be going to the dentist?
Honestly, people with HIV should be going to the dentist more than the recommended every 6 months. The 6-month rule was actually determined by insurance companies. Most people require good cleaning every 3 to 4 months. So if your insurance allows it, some do, I would recommend it. But it's important to keep your mouth and your teeth clean for your overall immune health.
It's interesting you said that. I think it's been a year since I've been to the dentist.
Carl.
I know. Here I am spouting all this stuff about it. Just break it down a little bit more for me, like the importance of just how sick can you get through your mouth? We go, I've got a bit of a, bleeding gum. Should I be worried?
Absolutely. Bleeding gums means that there's inflammation. There's, disease in your mouth. It's not acute. It's usually a chronic infection. So it takes things a little bit longer to get worse, but it's really imperative that you keep your mouth clean. And it's usually your gums mostly that contribute to the systemic health issues like cardiovascular disease, diabetes, and all of these other obesity. There's a lot of different things that are affected by having inflammation in the mouth. And I think we're going to talk about it, but that's one of the things we have to look at and look out for with COVID is the inflammation.
So let's move on to COVID. First of all, I think that the main one is, everyone's telling me wear a face mask, stay 6 feet away from people, socially distance, don't leave your house. Oh, great idea. Go to the dentist with my mouth wide open and somebody's face right over mine. Dispel give us some of the facts and some of the fiction about visiting the dentist during COVID.
Absolutely. So in dentistry, we've always been dealing with, aerosols and people's saliva going everywhere. So to be honest with you, with the exception of, N95 masks, a lot of things in the dental office have not even changed. Obviously, we're wiping down a lot more. We're increasing our ventilation, things like that. But we have vacuums in your mouth while we're drilling, so there's a lot of precautions that were already in place before COVID. So now you're going to see there's less people in the waiting room. If you're fearful of going to the dentist, go early, be the first appointment of the day so that, you're the first one. It's a fresh office for you. But it's more important to go to the dentist when there's a pandemic like this going on, because we want to keep you out of the emergency room. We want to keep dental emergencies out of the emergency room. So prevention is key. If we could get to something before it causes an abscess, an infection, or, these long-term problems, if we could get to that before you're in pain, which is usually the dentist's job, is we want to get to things before you're feeling pain. Do it while you can. We don't want you in the emergency room potentially contracting COVID there and being complicated with HIV and other systemic problems. It could really cause a storm.
Yeah, do a number on you. And obviously that's talking about your job and what you do. But what about the simple thing of just going to the hygienist? Is that something I can afford to put on hold for 6 or 9 months because of this COVID thing? Or should I still be keeping up my regular cleaning schedule?
Absolutely. Keep it up. Don't slack on it. We're all taking the proper precautions in the dental office to keep you safe. And we want to keep the inflammation in your body down. I'm going to kind of get into the nitty gritty here, but most people die or most people have complications with COVID due to systemic inflammation. So there's local inflammation when there's gum disease. So if you haven't been to the dentist in a year, there's more inflammation in your mouth than there normally is. And that's sending off these cytokines. Cytokines are inflammatory proteins. So these inflammatory proteins are already elevated in your body if you have bacteria in your mouth and gum disease. So we want to keep that low because those cytokines are predictors. If you have high cytokine levels when you have COVID, there's a 90% chance that you're going to go onto a ventilator. And if you go onto a ventilator, there's a 70% chance that you can pass. So we want to keep people off of the ventilators. And the way we do that is keeping inflammation down. A step that we can do to prevent that or to keep those levels low is by doing a good cleaning routinely, not every year or every 6 months, routinely every 4 months.
I feel I've been shamed a little bit by reviewing my bad. I feel like I need to rush down to Dr. Patan's office down the street now and book in for a cleaning. Peter, this has been really, really interesting. As far as sort of just maintaining good oral hygiene, give us some basic tips. We know brush our teeth twice a day, floss. I'm terrible with the flossing, but I use the mouthwash and I do brush my teeth twice a day. What else can we do at home to really make sure our mouths are staying as healthy and fresh and as best they can?
I think you kind of highlighted what the problem is it is so simple to brush your teeth twice a day. And floss, you should be flossing. If you're not flossing, you're missing 35% of your tooth that you're not brushing. So brush and floss. If you do that and visit your dentist regularly, even if it is every 6 months, we're going to catch things early and catch them before you have those high inflammatory proteins, those cytokines, and just keep your mouth and overall body healthier. So yeah, you really don't, there's no secret. There's no, silver bullet. You just have to brush, floss, and visit your dentist regularly.
There it is. And if you're living with HIV, all the more reason you should be going and taking good care of your mouth, right?
Absolutely.
Peter, it has been a pleasure. Thank you for spending a few moments with us on this episode of Plus Talk. If you want more information about what we've discussed today, check out the website, pluslifemedia.com. Be sure to follow us across social media at @PlusLifeMedia. We'll also put Handsome Peter's social media handles on there too, so you can check him out if you've got questions. DM him as well. That'll do it for today. We'll see you next time.